Hi everyone, this is Dr. Heather Austin Robillard, and this first lecture will introduce you to the eating disorder class by talking about body image. The way an individual perceives their body, shape, size, and weight is influenced by numerous factors, such as cultural socialization, interpersonal experiences, physical characteristics and changes, and personality traits. Body image is a criterion for many of the eating disorders that you will learn about in this class. In this module, you will learn about body image, both positive and negative, several terms related to body image, such as body comparison, body avoidance, and body checking, and the factors that influence body image. Before we begin, I want you to think about what you think is important for the foundational understanding of body image in this course when it comes to eating disorders. Body image is viewed as being one of the most reliably observed risk factors for the development of an eating disorder, and a disturbance in body image is a key diagnostic feature or one of the signs or symptoms used to assess and diagnose eating disorders, particularly when it comes to anorexia or bulimia nervosa, which we will learn about later. Body image, or BI, is the way that you see yourself and how you imagine that you look. Body image is what you believe about yourself, including any memories you might have or assumptions or generalizations. How you feel about your body, including height, shape, and weight, and how you sense and control your body as you move. BI is a multi-dimensional construct and includes your perception of your size and shape, the satisfaction with your appearance, your body esteem, your acceptance or self-loathing of your body, any body anxiety you might have, and the salience of weight and shape. Renfro Center talks about how each of us has a picture of ourselves in our mind's eye. That image, coupled with our belief in how we perceive ourselves, constitutes our body image. Body image becomes who we are. Why could this be problematic? So let's look at some of the terms you're going to hear often throughout this course that relate back to body image. Body dissatisfaction. This is a wide range of negative body image experiences in a generic way. What would an individual potentially be diagnosed with if they had body dissatisfaction reached to an extreme? This might include body dysmorphic disorder. This is a body image disorder characterized by persistent and intrusive preoccupations with the imagined or slight defect in one's appearance. Most of us would probably report that there is something about our body that we dislike or about our appearance. But these dislikes do not interfere with our daily life. A person diagnosed with BDD or body dysmorphic disorder is going to spend hours a day thinking negatively about their perceived flaw. Although an individual with body dysmorphic disorder can dislike any part of their body, most often the fault is found with their hair, nose, chest, skin, or stomach. This preoccupation must cause a significant amount of impairment in the individual's life for it to be considered clinically significant and diagnosable. What is important for future professionals to know about body dysmorphic patients is that they are much more likely to reach out for help with a plastic surgeon and seek surgery than they are to consider psychiatric help to address any mental health issues or concerns. The next term we're looking at is body comparison. The tendency to compare one's body with others in person or in the media, and especially to make an upward comparison that results in the negative evaluation of their own body. This has been identified as a risk factor for the development of body dissatisfaction. An upward comparison example would be an individual who is not famous looking at a model or actress's body and comparing it to their own, which can be even more problematic when you add in photoshopping into a celebrity's picture. The next two terms that we're going to cover are the behavioral expressions of body dissatisfaction and can contribute to the development and maintenance of body dissatisfaction. Individuals with a diagnosed eating disorder, particularly anorexia or bulimia, are very likely to engage in these behaviors. The first one is body avoidance. This refers to the behaviors that are designed to prevent or sidestep situations that provoke concern about our physical appearance. Not weighing oneself, ignoring or covering mirrors, wearing baggy clothes, or not going into situations where they feel physical scrutiny. Body checking relates to the critical scrutiny of one's body, size, and shape, including examining oneself in the mirror, using the fit of clothes to judge whether their size has changed, feeling for bones, seeking reassurance from others about their shape, or making negative comparisons with others. So let's talk briefly about positive body image. There's not as much research out there about positive body image versus negative, but here are some characteristics that identify a positive body image. There's a clear and true perception of your shape. You have acceptance of your body. You feel good about your body and what your body can do. It's not based on your appearance, but more about how you feel in your body. There's acceptance, appreciation, and love for the unique differences about your body and others. You feel comfortable and confident, and there's an understanding that the person's physical appearance says very little about their character or personality traits or value as a person. So let's talk about some ways that we could create positive body image, either within ourselves or within others. How do you think individuals can work to create a positive body image? Think about your body as a vehicle to your dreams. Honor it, respect it, fuel it. Create a list of the things your body lets you do. Read it and aloud and add to it often. Become aware of what your body can do each day. It is an instrument of life, not an ornament. Don't let your weight or shape keep you from activities that you enjoy. Keep a list of about 10 positive things about yourself that does not mention anything about your appearance. Consider that life is too short to waste time hating your body. Another way that individuals are attempting to create positive body image is through the social movement of positive body image, which aims to redefine and rewrite the labels of the ideal beauty. This encourages women and others to be more accepting of who they are, using positive language regarding their body and prioritizing health before beauty. We can also see this in advertisement of some brands. For example, the different Dove commercials that are focusing on different body types. These are some of the factors that will let you know that it's a negative body image. There's a distorted perception of your shape. You perceive parts of your body unlike they really are, so either bigger or smaller. Body is perceived to not measure up, so whatever this ideal, it doesn't measure up. You feel ashamed or self-conscious or anxious about your body. Feeling uncomfortable or awkward within your body, or potentially not seeing your body as it truly is. You may become convinced that the only other people that are attractive and that your body size and shape are a sign of personal failure. Body image disturbance is being unable to accept a compliment, being overly affected in their mood by how they think or look. One example might be getting on the scale and having a good or a bad day dependent on whether you gained or lost weight. Constantly comparing themselves to others. They call themselves disparaging names like fat, gross, ugly, flabby. They attempt to create a perfect image of themselves. And they seek constant reassurance from others about their looks and making sure that they're acceptable. It is important to understand that not only can negative body image or body image disturbance lead to the development of a disordered eating and eating disorders, but it also can lead to anxiety, depression, low self-esteem, shame, trouble concentrating, risks to their sexual health. You might cut yourself off socially or stop healthy activities related to your body. and over-exercising or overeating. A body image disturbance constantly overstates the size of their body or their body parts, believing that if one could attain their goal weight or if they could just get to the size they wanted, they'd be able to accept themselves. They make the enjoyment of life pleasures or pursuit of personal goals subordinate to their appearance or this drive for thinness. They equate thinness with beauty, success, perfection, happiness, confidence, and self-control. There's a compartmentalization of one's body parts, thighs, abs, arms, hips, rather than feeling connected to the body as a whole. Having an ever-present fear of just being fat, or even if one is slim. And they also may have an overriding sense of shame about themselves or about their body. So let's briefly talk about body image differences among genders. So I'm going to primarily talk about the binary genders of women and men. So women are most likely to be dissatisfied with their appearance, but over time this has been changing for men. Past research on body image issues are more recently critiqued as being flawed. Reviewing the old research on gender differences associated with body image formerly believed that men are far less likely to have body image issues. And that's why eating disorders and body image has often been viewed as a woman's issue. However, researchers who have looked at gender and body image that used pro-thin ideals of one's body as the marker for body image dissatisfaction, believing that people are only dissatisfied with their thinness, believing that they're only dissatisfied with their body if they do not feel like they're thin enough. However, researchers have come to have a better understanding of body image issues and gender. There is now a recognition that the flaw is on how body image issues may differ between genders, with women tending to focus on body weight and men focusing more on fitness and muscle. Thus, it is important to know that women are more likely to report body dissatisfaction with a perceived excess of weight, whereas men are more likely to be dissatisfied with a perceived lack of muscle or a concern about their fitness. In men, body image issues often begin with having a history of being overweight. However, there has been a significant increase in body image issues for men through the use of social media, with men observing and comparing their bodies to those that they feel are in better shape to them. We will now transition into the understanding of some of the factors that can relate to the development of body image. Cash 2008 researched the different factors that influence our body image attitudes. This includes cultural socialization or media, interpersonal experiences, family, friends, physical characteristics and those changes, and then certain personality traits. Each of these factors has potential to influence the development of either a positive or negative view on our body. What are some examples of cultural socialization and how it would influence body image development? Think about what are some personality traits that may relate to body image development. Maybe low self-esteem, depression, perfectionism. These have all been identified as relating to the development of a negative body image. We also know that different developmental stages of our life may impact our physical characteristics, which create changes in our body that influence our body image. What comes to mind as important or developmental periods that could significantly impact somebody's body image? With the development of periods for women, we can think of puberty changes that happen to our body depending on whether we hit puberty earlier than others or later. This can influence the way that we view our body. Other developmental time points that can impact body image might be after the birth of a child or menopause, or suffering from an accident that impacts our appearance. Interpersonal experiences include the messages that we hear from our friends or our family. These messages can be indirect or direct. For example, an indirect message may be, do you really need that second serving of French fries? You probably are full. This is an indirect message from the person that does not directly state they are concerned about their weight, but the remark about how much they're eating may send the message that there's a concern about body shape or weight. Dietary restrictions in young adolescents from friends or families also typically predict a negative body image. While most research has been around the mother's impact on her daughters or children in general, the research on body image development is coming out that the father's role also impacts the development of certain body image issues, whether that be positive or negative. Some other direct messages might be weight-related teasing from your friends. The final topic that I want to discuss is the introduction of weight bias and weight-related discrimination. Weight bias is the negative attitudes, stereotypes, and either overt or covert actions and expressions that affect our interpersonal relationships and interactions. Negative messages about being overweight are relentless in our society, and many who study this topic would argue that overweight is the last group for whom overt bias and discrimination is still socially acceptable. Researchers have documented that weight bias occurs in many settings, including healthcare, education, adoption, jury selection, or even obtaining housing loans. Such discrimination is the result of living in a society that perpetuates the pro-thin and anti-fat attitudes. Just think about the common stereotypes that we associate with someone who is overweight, maybe lazy or unclean, not healthy, or even unintelligent. The prevalence of weight bias in the United States has increased by 66% over the past decade and is now comparable to racial discrimination, particularly for females. These inequities translate into concerns of employment settings, such as a disadvantage of hiring, wages, promotions, or job terminations. Healthcare facilities that healthcare workers possess negative attitudes towards obese patients, believing obesity is a behavioral issue, which leads to avoidance or delayed seeking of preventative care. And educational institutions often, due to the widespread negative stereotypes that overweight and obese persons are unmotivated. This lacks in self-discipline, less competent, sloppy, and non-compliant stereotypes. There are so many negative consequences related to weight bias, including psychological issues such as mood disorders, decreased self-esteem, and body image concerns. Weight bias is often internalized and is linked to negative body image. The highest impact is on females, those with higher degrees of overweight and binge eating behaviors. Research has found significant positive association between experiences of weight bias and stigma and body dissatisfaction among both non-clinical and clinical populations, even after controlling for age, BMI, and gender. As you continue to think of the many factors that play a role in body dissatisfaction, it is important to not only consider how our society's pro-thin ideals send a message about ideal body, but that these messages have contributed to a society where weight bias is at an all-time high and that individuals with a larger body size are being discriminated in most domains of their lives. So let's think about how we can help. As you complete this course, I want you to think about how you make an impact on others. How do we help to create positive body image? Base your compliments on attributes other than size, weight, or shape. Minimize diet and weight talk. Never joke or shame anyone because of their weight or size. Examine your own attitudes about weight and size, even if it's about yourself. Raise your own and others' consciousness about cultural bias regarding thinness. Believe that a person's body image distortion is real for them, not just attention getting, and respond in an empathic manner. Be knowledgeable about professional resources for help. These include dietitians, psychologists, body image specialists, counselors, etc. Discourage dieting or weight loss fads. Instead, promote wellness lifestyle. Don't equate thinness with happiness. And remember that there is no ideal body. Beautiful bodies come in all shapes and sizes.